Making Medicaid and CHIP coverage part of a healthy summer. We have a great lineup of speakers today that are going to talk to you about how you can stay connected with families throughout the summer. And before we get started, I'm just going to go through a couple of webinar housekeeping items to kick us off. So we will have a question and answer session at the end of the webinar, but we encourage you to submit your questions as you have them through the chat box in your control panel. That's the little gray box on the right-hand side of your screen. At the end of the webinar, we'll kind of read those as they come in chronological order and allow our great speakers to speak to the questions that you have. Just in anticipation of often the most popular question, a copy of the slides and a recording of the webinar will be available on insurekidsnow.gov in about a couple of weeks following the webinar. It just takes us a little time to get it up on the web, but then a copy, a transcript, and a recording will all be available to you. With that said, I'm going to hand it over to Donna Cohen-Ross, who is the Director of Enrollment Initiatives at CMCS, to kick off our webinar today. Donna, I'll pass the mic to you.
Thank you so much, Riley, and welcome everyone this afternoon. We are very excited about the webinar that we have today because, as we often try to do, we like to bring together some of our Connecting Kids to Coverage partners and grantees with some new national partners to see what kinds of connections we can make for all of you, and I think we're going to manage to do that quite well this afternoon. I'm going to introduce the various panelists as we go through the presentation, so you'll meet them as they begin to speak. But first, I think you all see on your screen now the agenda for this afternoon. Let me just give you a quick walkthrough of what we're going to be talking about this afternoon. We're going to be talking about including health insurance enrollment in summer food service programs. As many of you know, when school's out and children who rely on the school lunch and breakfast programs don't have access to those programs anymore. In many, many communities across the country, the summer food service program steps in to provide that nutrition to children, but also, as we'll learn, there's lots of other opportunities to work with children and families through those summer food program settings. Then we're going to hear from Safe Kids Worldwide. They'll be talking about keeping kids safe and healthy all summer long. Lots of really great ideas for making connections with summer programs, making connections for all of us trying to do our best to identify children eligible for Medicaid and CHIP and get them enrolled. We'll hear about how Safe Kids is working on the ground in one community, with that, we're going to be able to hear a little bit about what's happening with, again, on the ground with some of our outreach grantees and partners. Then we want to take an opportunity to begin our conversation about back to school time, which I think all of you know is one of our most productive times in terms of helping families get their eligible children enrolled in health coverage. It's not too early to be thinking about that, and we are really trying to advance the ball very quickly by jumping in at the end of this webinar to begin to plant some of those seeds, and we'll be also looking at some of the Connecting Kids to Coverage campaign resources. We should jump ahead. I think just want to give you some of our overall messaging, and those of you who join us on our webinars on a regular basis know that one of our main messages, one of our most important messages, is that Medicaid and CHIP are always open for enrollment of eligible children and parents too in Medicaid. More than ever before in many states, it's always enrollment season for Medicaid and CHIP. So if you have families who have eligible children or parents who might be eligible themselves, they haven't missed out. It's not too late. We always want to have that message front and center. And then we also want to today really focus on the opportunities that are available during the summer months to work with children and parents who might be eligible for coverage. And so I think we're going to dive right into our first speaker now. I want to welcome Sonia White. She's the Director of Coalitions and Planning at the Community Council of Greater Dallas. And Community Council of Greater Dallas is a longstanding Connecting Kids to Coverage outreach and enrollment grantee. We've been doing lots of great work together over the years, and this is just one more thing that we know Community Council can share with all of our listeners and participants today. So Sonia, welcome.
Well, thank you so much, Donna. I'm very happy to be here and to be able to talk about how to incorporate CHIP and Children's Medicaid outreach and enrollment with summer food service programs. I am fairly new to Community Council, but I'm not new to summer food service programming, where I spent about 12 years doing that prior to coming to the Community Council. So it's been a great way to combine what's happening at the Community Council to what's going on in our community. But the Community Council of Greater Dallas has a great history in our community. We are celebrating 75 years this year, and we have done a lot of work around identifying social service issues that need to be addressed, and then putting the action in place to address those issues. And I want to focus on what we've done around expanding governmental programs, such as the CHIP and Children's Medicaid outreach and application assistance. We also had a grant to do the health insurance marketplace and provide navigator services. So we really are working to expand access to health coverage for our community. Next slide, please. The way that we are able to make these connections to health coverage is through several different areas. We house and manage the 211 information and referral service for the Dallas region. So we are constantly fielding calls which may be addressing health insurance or other needs in the community. We provide direct application assistance with CHIP, Children's Medicaid, SNAP, and TANF. And then again, we're offering this enrollment and outreach service through the Affordable Care Act. Our biggest area of focus is probably connecting our community to health coverage, and we think that this is a great way to really use our Connecting Kids to Coverage grant. So some of the relationships and partnerships that we've developed over time is we use the City of Dallas WIC clinics, where we're able to go into the clinics on a weekly basis and provide application assistance and outreach. We also partner very heavily with Dallas ISD schools and health services, and we have become like their go-to resource. When they have a complicated case and a family needs special assistance, they've really gotten to where they call us and we'll set up appointments with those families. But we have other partnerships as well. And one of our newest partnerships is really diving into the summer food service program sponsors and really using those sponsors to conduct outreach and application assistance. I want to give you a little snapshot of Dallas County Summer Food Service Program because we have a very robust and sophisticated program in Dallas County. We have a very high rate of eligibility in Dallas County, with approximately 90% of the Dallas ISD children are eligible. In Dallas County alone, we have about 1,300 summer food service sites. And those sites last year served almost 7.5 million meals in Dallas County. This participation rate represents about 30% of all of the summer food service participation for the state. So pretty much everywhere you go in Dallas County, you're going to find a summer food service site. So this gives us an opportunity, if targeted correctly, the summer food service programs can be a great audience for CHIP and Children's Medicaid outreach. What we have done is we have used our coalition network to leverage the impact that we can have. For example, we have the Dallas County Coalition for Hunger Solutions, and this coalition allows us to really bring awareness to the importance of having health insurance for children, and really combine that with the same need to have access to food and healthy foods. So we really have been able to work very closely with them and really make that messaging very similar and parallel to one another. Within the Coalition for Hunger Solutions, we have a breakout team called the Child Hunger Action Team. And this team meets regularly to really just promote all child nutrition programs. So what we've been able to do with that group is work with that group and use that group as a resource for volunteers. And so they actually can assist us with doing outreach around CHIP and Children's Medicaid. The Charting the Course subcommittees, they're also focused on the out-of-school time activities. And as we know, and as Donna mentioned, these out-of-school time activities are great opportunities to do outreach for CHIP and Children's Medicaid. The last council that's really been a great resource for us is the Summer Food Service Program Sponsor Council. And this council is geared very targeted to the summer food service sponsors. And this gives us access to the decision makers at these summer food service sites. And once we can meet with them directly, we can really work very collaboratively with them and plan for how we're going to do outreach each year. So this year we have several months ago started our planning for the outreach for summer food service programming. But what we typically do every year is that we try to plan a series of summer food service kickoff events that happen during the usually the second full week of summer. For us this year, that's going to be June 15th through the 19th. And during this week, we'll do unified messaging and mass messaging to make the community aware of summer food service sites. Because all of this is going on and we're able to get a lot of concentrated media attention, it's also a perfect opportunity to get our CHIP and Children's Medicaid messaging out there as well. So what we find is that our summer food service sites really want to work very closely with us, and we can help them get the word out about the summer food service sites, and they help us get the word out about our CHIP and Children's Medicaid. We're also this year for the first time encouraging our summer food service sites to host midsummer events so that we can continue the messaging and outreach throughout the summer. Usually after July 4th, we kind of have a lag in participation, so this is a way to get that message back out there and to try to avoid that lull that we usually see in July. When we are looking at partnering with summer food service sites, some of the things that you really need to keep in mind is that it can sometimes be very challenging to actually have access to the parents at these summer food service sites. So when you start planning to collaborate with these summer food service sites, really think about when are the parents there? Are they dropping off or picking up the children, or do the children mostly walk to these sites? You want to try to target a site where they may have a lot of structure, where it's maybe a half-day program or a full-day program, and that usually provides better access to the parents. We also like to partner with sites that are going to have special outreach events. Just like we mentioned earlier in the earlier slide, having kickoff events or end-of-summer events or back-to-school events are a better way to gain access to the parents. And don't look at the partnerships with these summer food service sites as being just a one-time partnership. We find that these sponsors are doing activities with families and children throughout the year. Even if the summer food service program is their main focus, they usually have relationships with their families throughout the year. So use this as an opportunity to collaborate with them and to also look for opportunities outside of summer to do outreach and enrollment with these sites. They may have special events during the school year, or maybe right before the summer starts, they'll have an event as well. So this is a great way to continue collaboration with your summer food service sites. So if you are looking to really start using the summer food service program as a resource, you may want to educate yourself a little bit more about the summer food service program, or maybe you want to work alongside a summer food service site and be able to offer them some resources and some help. If you need to find more information, I've listed some of the 4 best, I think, resources for summer feeding. The Food in Action Resource Center just overall is a great resource for anything around hunger or child and food insecurity. So they're just a great go-to. But they have a special area on publications, and they have some great downloadable items, fact sheets if you want to do press releases and you need some facts and figures about your particular area. They have some great resources. Share Our Strength is another good source with their No Kid Hungry campaign. They have some great downloadable tools that you can use. And then, of course, the United States Department of Agriculture can offer you a lot of resources as well with a lot of their downloadable. You can order resources from them that are free and at no cost to you. So that wraps up my presentation. I hope that what I've shared has been helpful.
Great. Thank you so much, Sonia. I think that was a really great step-by-step how to think about a partnership with summer food service program and also how to execute it. So I think we really got the full range from you, and I know there'll be questions for you at the end, so hang on with us. I'm going to welcome our next speaker, Tarika Wheeler, who is the Director of Programs at Safe Kids Worldwide. Tarika, welcome. We are really eager to hear about Safe Kids and begin to think through with you how we might partner with Safe Kids in local communities so that we can work together on keeping kids safe and healthy. I think that's something that our 2 organizations have in common. So thanks, Tarika. Welcome.
Great. Thank you so much for having us on the webinar today. So just a little bit about Safe Kids. Our sole mission is to prevent unintentional injuries to children. We work really closely with a large network of coalitions, both here in the U.S. and around the world, to ensure that we are developing evidence-based programs, campaigns, resources, and materials that are all really driven towards our mission of keeping all kids safe from preventable injuries. So we know, and this may not be surprising to all, but we do know that preventable injuries are the leading killer of kids here in the United States. Millions more kids are injured every single day, and they are presented in your community local trauma centers. They're being followed by your practitioners there in your communities, and oftentimes are families with social and economic challenges and may be eligible for the programs such as Medicaid and CHIP. Again, we're a global organization, and so I'd be remiss if I didn't speak to this being a global epidemic, and knowing that 1 million children a year around the world, unfortunately, also are dealing with the injuries and the deaths as related to preventable injuries. So a little bit about our work here at Safe Kids Worldwide. We, as a national or global organization, really focus on developing programs that we can provide to our network and delivering the programs through a community-based approach or a grassroots approach. We focus on 3 different areas: road safety, home safety, and school sports and play. And our primary age group that we look at are those kids that are 19 and under, which would all be within eligible of the programs that you're looking at. And we also have those emerging issues that come up where there may not be kind of a main topic, but they pop up in emergency rooms, or we start to see trends and hear from our partners such as button battery ingestions with the coin lithium batteries that unfortunately some children get a hold of and swallow, TV and furniture tip overs, and then those recently the issues that we've seen around children gaining access to detergent laundry packets. So we have a really robust scope of work in looking at the full spectrum of unintentional injuries. So when we talk about impact, Safe Kids, since its inception in 1987, has been working towards this sole mission, and along with our partners and our sponsors that we work with, we've been able to be a contributor, and I'd like to say a driving force to the decline that we've seen in the U.S. of the number of kids who unfortunately die to unintentional injuries. And we have a goal that we'd like to see by 2020, another 50% reduction in those deaths. And we believe that's attainable through partnerships at the grassroots and community-based level, through partnerships and unique partnerships and opportunities like this group, and how we can get injury prevention infused into other services that are being provided for families. So a little bit how we work. We start everything with research. We, on average, do about 4 to 6 research reports annually, and the important piece here is just knowing that we're using the data from the field in order to inform the work that we're doing. The next element of our work is programs, and we support our grassroots network of nearly 400 coalitions in the U.S. and 25 global members around the world, and we are developing programs in road safety, in home safety, and making those readily available for them, oftentimes in English and in Spanish and other language where applicable, so that they can use that at the local level. We then look at awareness. We know that, it's 2015. Parents are receiving their information in a different way, whether it's through mass media. Social media is really big right now, of course, and we also know even with those families who have these social and economic challenges, you oftentimes are still seeing a cell phone that's in the home, and so and that they're engaging in social media, and so we use that and leverage that from our research reports to launch very visible campaigns. So that families can get the key messages around injury prevention. And then finally, it's important for us to advocate for new and improved laws. We are following at all times the laws that are happening at the state level, but also at the federal level through Congress that can have an impact on the childhood injury prevention, whether if it's stronger laws that are needed or more funding that's needed to support such an issue that continues to be an epidemic in this country. So it's really important there that we really think through, this is how we work, that there's a dual message here, whether, how we're working and getting those key messages out to communities and thinking about the health through coverage and healthy through safety and making that connection. And so when there's thinking about the child who goes into an emergency department, one of the first things that they do after triage is they're asking the question around coverage and for those families. So we know that there's a connection there, and I think there's some nice synergies here of resources from Safe Kids perspective that can be infused into the work that you're doing. So a little bit about our reach. We really look at measuring how we're able to get the word out, given, again, this time and age. We look at our media impressions, our Facebook, Twitter followers. We do a lot of videos in both English and in Spanish, which are a great way to reach families and get their attention onto a particular issue. Like I stated, we have a little over 400 coalitions here in the U.S. And a great number of partners around the world. And we really do use this network and our tactics for reach to get those key messages out there to communities, to parents and caregivers, to educators, to healthcare providers, so that we are really driving to our goal for 2020 to reduce the number of kids that we unfortunately see fatalities from due to preventable injuries. So I want to talk a little bit about reaching communities through preschool-based education programs. I think that when you're looking at ways to bring an added value and just kind of additional information for the organizations or clients that may be served, it's really thinking about what are those other layers and messages that can be shared with them in order to, at the end of the day, protect the well-being and safety of the child. And so I'd like to talk a little bit about the resources that we have available that you can access and how you can connect with Safe Kids. So one of the programs that we have is our Start Safe program, and this program was designed to give preschool teachers, local educators, and other safety experts a tool that they can reach preschool children and their families. And we really had an emphasis on reaching those families in underserved communities, working a lot with Head Start programs, knowing that oftentimes in going into communities where Head Start programs are operating or serving, that there are adults with low literacy skills and levels. And, you know, one of the things I think is a good connection here is the demographics in which we're trying to reach with this program are in alignment to where there could potentially be eligible kids for the Medicaid and CHIP program. So I think it's a nice dovetail when you're looking at what are those additional resources and support that you can provide to communities, to families, to organizations and clients from an injury prevention perspective that are targeting the same demographics. So I'll talk through the Start Safe program, but all of these materials can be found on our website at safekids.org. So currently with our Start Safe program, we offer 3 components. We have a Start Safe Fire, Start Safe Water, and Start Safe Travel. And those are each really built with various different components for whether if it's the educator, it's the parent, or it's the child. We're looking to enhance the program and revamp the program for 2016 to really be a comprehensive educational tool that provides tools and resources for keeping families safe in those same pillars that I talked about at the beginning. So we really want to address at home, at play, and on the way. And what are those key areas for preschool-age children and their families that we can focus on in each one of those pillars to reduce the incidence of injury, so a little bit of risk reduction there, as well as those fatalities. And again, I think that all ties back into when you're talking about covering kids through programs such as Medicaid and CHIP, because when these kids are presenting with these types of injuries into the children's hospitals and health systems across the country, there's that direct connection, and oftentimes those things are preventable. We know that several of the preventable injuries, we look at them and we know that there are strategies that could be put in place, and it's just putting those strategies in the hands of parents and caregivers and into educators and safety experts for them to educate communities. So let me talk about a couple examples in the Start Safe program. We really make sure that we provide different resources for the communities. One is educator guides. So if you are a Head Start teacher, if you are just a preschool teacher, or maybe you are an educator in a faith-based institution, you have a guide that introduces you to the program overall. It provides you with very detailed lesson plans so that you can very easily incorporate it into the current structure of the day, and then interactive games and extension lessons that can be used over a period of time that can be sent home with families. We also develop educational materials such as tip sheets, which is an example there, that you can use to reach parents and caregivers. So as you're talking with them about you know, having coverage for their children, or as you're entering into these types of organizations that are working with that, it's really, really key to think about what are those other pieces that you can provide them. So here's an example from fire and burn safety, where it's a very clear-cut tip sheet on how to keep children safe at home, and in particular looking at fire safety and cooking safety and burns. So very easy materials. All of these are available on our website for your use. The last piece of it is really the children's activities, and these are have been tested, evaluated. We've gotten great feedback from educators and safety experts, where the first image here of the firefighter, that's an interactive game that's online, and kids can match and pull over, drag over the pieces that they think would fit for a firefighter. The other piece here is a activity sheet that you can see is both in English and in Spanish that is used, again, around fire safety and talking about a smoke alarm and items that you should not be touching in the home, etc. But it's really just to reinforce the messages that not only we're giving to the parents, but messages that can be taught within the classroom setting for those preschool-age children, which really the emphasis for us is those kids that are 3 to 6 years old. So I want to talk a little bit about getting connected the first thing here is, partnering with your local Safe Kids Coalition, which you're going to hear from one of our local coalitions today, and partnering with them on integrating injury prevention into your outreach and the programs and resources that you currently have, having that added layer. There's a link here that will take you to a web page that we have by state, where you can see where your state is and click on there, and it'll show you all of the coalitions that are in your state, who the coordinator is, any contact information. One of the great resources that we hear about a lot of times is the free car seat inspection stations that are there, where families can make an appointment to work with a certified child passenger safety technician to ensure their car seat is installed properly. And in some communities, there are resources available where child safety seats may be available for families. So that's a great way to get connected. The second is to visit our website as a whole. So outside of the Start Safe program, we have, as you saw through Road, Homeschool, Sports, and Play, several different materials and resources that are available that you can download, and you can download them by age group, you can download them by risk area, and oftentimes they are both in English and in Spanish. And that's a great way for you to get materials to parents and caregivers. And then lastly, this summer, we have a biennial convention that we do. It's our Safe Kids Childhood Injury Prevention Convention, and it's July 29th through August 1st here in Washington, D.C., where our national office is based. And I encourage you, if you're looking for how you can bridge and connect the work that you're doing in the injury prevention space, to come to our convention. We call it PrevCon. I've listed the website there. And not only will you hear kind of the latest trends, but you'll also learn about programs that you can potentially have access to, bring back to your community for implementation. You'll hear latest research, trends in technology as it relates to childhood injury prevention, et cetera. And then a great amount of dynamic plenaries where you're hearing from the federal government, and others in the space of child safety. But we want you to get connected with Safe Kids. We have, again, a little over 400 coalitions across the country. We have at least one in every single state, and we would love to see where there could be connection there, and we think there's some natural synergies to connect childhood injury prevention with coverage as it relates to keeping kids safe and their overall well-being. So thank you so much.
Nope, go ahead. I was thanking you while you were thanking us.
I was thanking you for the opportunity and the time today to share about the work that we're doing and the resources that we have from Safe Kids Worldwide, and look forward to any questions towards the end. Great.
Tarika, now let me thank you. That was a really terrific presentation, and just as you were talking, I think many of us, myself included, we were just making some mental notes about the connections that we could make with many of the different kinds of programs that you talked about. And so I know I'm looking forward to some of those linkages as we go forward. So thank you so much for sharing with us this afternoon. I do want to remind everyone who's listening that if you have questions for any of the speakers or comments that you'd like to make, use that chat function on your screen, and we'll be looking there for questions when we come to the end of our program. But before we come to the end of the program, we actually have one more speaker, and that's Bevan Maynard, who is the supervisor at St. Joseph's Children's Advocacy Center in Tampa. Welcome, Bevan, and I think you are going to put some local focus on some of what we heard just a moment ago from Safe Kids. So we're very eager to hear how this all plays out in Tampa. So I'm passing the mic to you.
Okay, thank you so much. But yeah, so St. Joseph's Children's Hospital, we're in Tampa, and we are the lead agency. And that's how a lot of the coalitions work, is they have a lead agency that actually funds a Safe Kids position. So we actually have 3 of us that kind of focus on Safe Kids, which is quite, I think, involved when you think about it, but Hillsborough County is huge. That's why it's technically Greater Tampa. So we are the lead, and we not only do Safe Kids Tampa, but we also have the Kid Care for Florida. So we have the CHIPRA and assist with some Medicaid. So we are lucky because we have both of our kind of health insurance programs, application assistance, and our community outreach and education for injury prevention in the same department. So as you can see, if you look at our focus areas, it's quite comprehensive. Just last year alone, if you looked at all of our programs, we were able to educate over 49,000 people. And that's attending about 800 different classes and events. So we're everywhere. We mainly focus on unintentional injury prevention, not intentional injury. And then with Safe Kids, again, it's community, and we also have a really large school-based program. We're also lucky to have access to 6 different family support and resource centers that are actually funded by our local children's board, which is through property taxes. And that's really been an asset to reach the parent. And we even have trained them to be injury prevention outreach, education, and tied into application assistance for our kid care. We have a safety store, and that's actually on site at our children's hospital. And we kind of call it our kid care hub, where we are there about probably 30 hours a week, where we're able to work with families and getting them insured and checking on their status. We have a mobile medical clinic, which also we make sure that if they're on Medicaid, or if they're waiting for Medicaid, or if they need kid care access, we have somebody on the bus that's trained. We cover legislative advocacy for anything from trying to get Medicaid coverage for a mobile medical clinic to passing an enhanced car seat law. And the movement for the Children's Hospital and hospitals in general is this whole idea of preventing hospital readmissions, turning from more of a sick care system to a preventative system. So that's where I think a lot of the Safe Kids coalitions and children's hospitals are really looking outside of the hospital, outside of those walls, and that's where that partnership with Kid Care and CHIPRA and Medicaid come in. So Safe Kids Greater Tampa, we have a huge coalition. It's been growing. We consist of many different partners. We just had a Safe Kids meeting last month, and we had about 25 members there from different agencies. So we have government agencies, FDOT, FDOH, Healthy Start, Head Start. We work with other foundations. Raise Baseball Foundation was able to fund some swim lesson vouchers. Other nonprofits, drowning prevention coalitions and whatnot. We also focus a lot in churches because, again, we can access the families and parents. Anywhere from for-profit businesses. We have a partnership with AMSCOT. We have a partnership with a law firm. Health insurance companies, we've received funding from Florida Blue and other grants through their foundations. And really just parents. We have a network of families that have been struck by tragedies, and they've really helped us to pass new enhanced laws and to really just volunteer their time and their passion. And then again, because we are a children's hospital, and we have a very large network of pediatric offices too, so we also are reaching out to them as well. So again, when you think about Safe Kids Greater Tampa, it's quite comprehensive. We have 22 staff on our team that are PRN, so it's allowed us to go out to many different events with large number of staff. And so this is just kind of an idea of what we do. We have a huge child passenger safety program where we do have that direct one-on-one access to families. We distributed about 700 car seats last year, and those are all low-income families that also are screened through our family resource centers to see if they do have any type of health insurance. Same with our bicycle and pedestrian safety program. That's our school-based program where we're able to go into schools, which has also opened doors with our health insurance outreach, because we have those partnerships with our PE teachers and our school nurses, and are able to do bicycle safety clinics where we actually have a trailer that brings bicycles out to the schools and puts different grades on their bike, teaching them traffic safety skills. Of course, we're in Florida, so we have a very high number of toddler drownings. And so we have a coalition, the Hillsborough Water Safety Team, which is kind of a subgroup of Safe Kids Greater Tampa, that is actually now looking into mobile swim lessons to go into apartment complexes and subdivisions. Again, low-income housing where we are able to bring out our kid care information. And then, of course, home safety is, that's what we really see a lot of in our pediatric emergency room. So we have a large home safety program where we teach a Safe Baby Express class, and we work with Head Start, especially with safe sleep. We're seeing that really emerging need and fear. And then there's a little picture of our mobile medical clinic that we take everywhere on the bottom. So you can see that. Community events. These are just numbers where we've actually had a kid care table at our events. Again, we were able to incorporate kid care into our other outreach events, anything, lots of health fairs, lots of back to school events. October is a very busy month for us too with Halloween, and of course summertime, it's all hands on deck where we're attending about 3 to 4 events every weekend. Of course, August is the busiest because, like you said, it is back to school. But in July, what we found is targeting the host programs, which are out of school time, lower income programs, where we're able to go in, and we do have a parent component with that. So we were able to attend, as you can see, about 195 community events, and that's speaking to about 5,000 people. And that's over a little bit over a year, January to present. And this is what we do. This is what our staff, even if they're not application assistant trained, we're able to take these out. These are our tear-off cards, and there's more involved in it. I just put the 2 most important parts on there. But this is how we collect contact information from families that we then go back to our little hub at our safety store and contact the families to follow up. And this has been very successful because you're not only, it's not a list of people that are just signing up for more information. It's more of a one-on-one tool that answers questions. For HIPAA, this has been helpful too because we have a system where this information is only seen by our staff. So we have been pretty successful with this. We might get a phone call or 2 after. We always follow up, and maybe you might have to go back and forth a couple times, but we have had applications come from this. I think that's, there we go. So like Tarika was saying, all Safe Kids coalitions are very different, but the main programs that you are going to see them focusing on is the definitely child passenger safety, where it is a one-to-one parent thing, where you're either inspecting car seats or you're providing a car seat with education, or bicycle and pedestrian safety through a lot of Safe Routes to School programs, which is a national program. And then water safety in certain parts is also a really big topic. So those are the main things that they might focus on, but the whole idea of the coalition, these coalition meetings that they have monthly, and there's partnership agreements that your agency could sign up to be part of a Safe Kids coalition, because we don't turn anybody away. We do not turn anybody away. There's a place for anybody that's willing to work with us where it's a mutually beneficial relationship. And it's really allowed us, being a Safe Kids coalition, to take our hats off, because I know sometimes that's challenging when there's competing hospitals or there's competing agencies that are wanting the same numbers, but a Safe Kids coalition has really allowed us to do that. So very exciting and very busy, and that's about it.
Great. Bevan, thank you so much for that view from another vantage point for us all to hear about how Safe Kids and connecting kids to coverage can come together. I think you gave us a lot of really fine examples. So I think we're going to move on, unless, Riley, do we have time for questions now, or do we want to wait to the end?
We're going to wait till the end. We just have a few questions right now, so we want to get through a few more pieces of content, and then we'll open it up. And Donna, we're going to transition now into a little nod to back to school, just because we know that it's never too early to start planning, and we want to make sure folks have this on our radar. So we're going to kick it off with a poll. So we're asking all of our attendees to please participate. The poll just came up in front of you, and we just want to know, honest truth. Don't worry, it's totally anonymous. We can't see how you answer. If you started planning back to school, no way, summer just started. We haven't even had Memorial Day weekend. Not yet, it's on my radar, on the to-do list, or yep, I've started planning, or it is all set. So we just want to know where you are in your back to school planning. So please answer that poll question. I can see about 40% of you have voted so far. Take a minute to let us know where you are in your back to school planning. And again, this is totally anonymous, so we won't know if you're procrastinating, we'll say. I'll give you just a second here. All right. Looks like in the lead so far, we have about 40% of y'all not yet, but starting soon. Very understandable. 40% of you have started planning. This is great. 0% already have it all planned out, which I would be shocked if you did, because that would really be impressive. And I like that some of you are admitting that no way, summer just started. We haven't even had Memorial Day weekend. How am I going to plan back to school already? I'm busy. Great. So we'll close the poll there. We have about 20% no way, summer just started, about 41% of the people who have voted not yet, starting soon, and about 40% have started planning. And 0% have admitted that we have already have back to school all planned. So appreciate your honesty there. Donna, we're going to hand it back over to you to just talk about a few ideas to kind of get our creative juices flowing for the back to school season.
Great. Thanks, Riley, and thanks for the poll. I think those folks that answered C, we've already gotten the ball rolling, you know, are a little bit ahead of the game, but as many of you know, schools are starting to think about, you know, the end of school, and I know many schools don't totally close their doors over the summer, but certainly to get to some of the staff members that you might need to get to plan a really robust back to school activity. There's no time like the present, so hopefully that will give us a little bit of a push. It's a perfect time to start planning if you haven't started already. So I would just say that we're in the camp of let's move forward. It's back to school, as we've already, I think, I mentioned earlier, and some of our speakers mentioned, it's a great time to do outreach to families with children who are eligible for Medicaid and CHIP. When they're thinking about getting their children ready for school, very often they're thinking about what kind of health care do kids need to start school. They might be in need of some immunizations. Sometimes kids have to have a physical before they can participate in sports programs or other kinds of activities. So we know that when families have health care on their minds, it's a great time to ask that question, is this child insured? Might this child be eligible for Medicaid and CHIP? And I think we heard our Safe Kids speakers nod to that kind of opportunity to ask these questions when they're doing their work on Safe Kids. I think the same is true for back to school in general. And of course, schools are a great place to share this information and offer help to parents because they are a trusted source of information. So we just wanted to give a little bit of some ideas to kind of generate some thinking. Many of you are probably already deep into some of these kinds of activities, or you've conducted them in the past and maybe are thinking about bringing them back again for this year's school back to school, or ramping them up to the next level. We're very interested in what you're finding most helpful. So again, you know, many schools do school supply drives, backpack days, and those are opportunities to also provide information about health coverage and how to sign up. If you take a look on the Connecting Kids to Coverage, the Insure Kids Now website, you'll go into our video library and you'll see some of those back to school activities. I think we have a great video from Providence, Rhode Island that looks at connecting kids to coverage during the backpack giveaway days. So that's something that we know has been helpful. With school registration, back to school nights, again, as earlier speakers have said, when you have parents on the premises, it's a really great time to engage them in discussion about health coverage. Moving on, very important to think about how to identify schools that might have larger numbers of uninsured children. I think our first speaker, Sonia, who talked about looking at working with summer food service programs. We know just like for school lunch and breakfast programs, the income eligibility for those programs and also for Medicaid and CHIP are very much in sync. They might not be exactly the same, but they're pretty darn close. And so when we're doing intake for the school nutrition programs or summer food service programs, it's a great way to identify children who might be eligible. We also know that there are so many opportunities to get to families with eligible children and also parents if we work with community colleges as well. Many of the students in community colleges are parents, young parents, parents with young children who might be eligible, and of course in many states those parents might be eligible for Medicaid as well. So thinking about working with community colleges at the same time you think about back to school for your elementary and high school, really important way to expand the work that we do. And again, building relationships with school staff, thinking about who in the school really makes a connection with families about health, whether it's the school nurses, it might be the sports coaches, it might be school-based health center personnel. There might be lots of different ways to make that connection, and always looking for those champions, those leaders within the school that can also help make outreach and enrollment part of that school culture. And again, we can look at some of those activities on some of our other outreach videos in our outreach video library. You can see where there's been some of those activities. I think we feature a school-based health clinic in Oakland, California, and also in Miami, Florida. I think you'll get to see one of those mobile health vans and look at what that connection with the school district does, not just for the kids in those school districts, but also for the medical students that staff that mobile health van. They're learning a lot about what it means to have uninsured children get insurance in the community and what that means to their practice and their learning. So all good things to think about. Great. Just thinking about, and I think some of our previous speakers talked about the variety of organizations that really make a referral network robust and very, very effective. Ways, thinking about distributing materials through networks, very important, but also thinking about how to connect on a more basic level in helping to figure out how to provide application assistance. And these are just some examples of the kinds of activities and or the kinds of partners, whether they're in school or part of the larger community, that we need to be thinking about for back to school.
Great. Thanks so much, Donna. I think that's really helpful to get kind of creative juices flowing in planning for back to school. I'm going to run through our Connecting Kids to Coverage campaign resources very quickly so that we can get to a few questions that folks have for our speakers. I think, as you all know, the Connecting Kids to Coverage campaign has developed a suite of resources for you to use. This includes customizable print materials that are available in English, Spanish, and some available in other languages such as Chinese, Korean, Vietnamese, Hmong, and others. These are customizable with your program name, URL, phone number, eligibility, and logo. Then we have some other turnkey resources here. We have TV and radio public service announcements, live read radio scripts, template print articles, web banners and buttons, and turnkey social media posts and graphics. We also, as we are doing today, we host webinars monthly on best practices in outreach and enrollment, and we archive those webinars in an online library so you can view past webinars that you might have missed. And as Donna mentioned on some of our back to school ideas, we have a lot of great outreach videos that feature organizations from across the country and their effective outreach and enrollment practices. We love for you all to be in touch with the campaign, and on this slide you can see a few ways to do so. You can reach out to us directly at this email, insurekidsnow@fleischman.com, or 1-855-313-KIDS. The best way probably to stay in touch is to sign up for our newsletter. Any webinar announcements, new materials, outreach ideas, etc., will be delivered to your inbox if you sign up there. And the campaign is also active on Twitter, so follow us at IKNGov. So with that, we're going to turn to some questions for our speakers, and we just have a few in the queue here, but if you have one for anyone that presented today, I encourage you to type it through the chat box. We're going to start at the top, though, with a question for Sonia about these summer food service programs. So Sonia, we have some folks on the line who have never really worked with a summer food service program and are wondering what the best way to get started is. Who's the right person to contact in your community, or how best do you kind of build that bridge?
Well, I think depending on, first identifying probably your state agency who administers the program would be a good place to start. For Texas, that's the Texas Department of Agriculture. But for many states, that might be the Department of Education. So I would say first identify who administrates the program at your state, reach out to that department, and first find if they are able to share with you who are the summer food sponsors in your area. And then that would probably be a really good first step for identifying who it is that might be willing to work with you.
Great. That's really helpful, Sonia. Thanks. Sometimes we just need the right first step to take to get going. I also wanted to say that you have a colleague in Texas, Teresa Calloway, that shared a couple of other resources. The Texas Hunger Initiative and Texas Impact both have wide-reaching networks in the summer food service program and may be good partners if you have some colleagues in Texas.
Yes, the Texas Hunger Initiative, actually I think they have 9 or 10 regional offices, so they're a really good resource, and that's actually who kind of leads up our Coalition for Hunger Solutions, which I mentioned in our presentation. So all the major cities all have a local Texas Hunger Initiative representative, and they are a great resource.
Great. Thanks so much, Sonia. Teresa, we're going to kick a question over to you now, and I know it's 4 o'clock on the dot, but I hope you all can stick with us. Pamela Gray has a question on the educational safety program you might have available for rural families, specifically wondering if there are any gun safety programs that you have, since children are often accidental victims of gun violence. Can you speak to that, Teresa?
Sure, absolutely. So on our website, we have several different materials under home safety. As it relates to gun safety, we really more speak to how to where guns should be placed in the home. We really go with kind of the up and the way piece, very similar to medication. We've made available to our coalition network, not necessarily to the general public, a gun safety toolkit that has tips, that has all different types of information that is there that families can use. So one of the things that we could do is you could get connected with a local coalition that has access to that, or I'm happy to connect you directly with some of those resources. I shared my email in the PowerPoint presentation.
Great. Thanks so much, Teresa. And we also have a question of whether there's a Safe Kids in Wyoming. Judith Strausberger wants to know. I think that's just a nice segue into encouraging people to go to your website, which is safekids.org. /coalitions is where you can find state-based coalitions, but safekids.org, you can find these safety resources as well as whether there are coalitions in your state. And Pamela just said thank you, Teresa, for answering that question. Of course, many of you have asked if there is a copy of the slides available. We will make a copy of the slides and a recording of the presentation available on insurekidsnow.gov in the coming weeks. And I think with that really wraps up our speaker-specific questions. Donna, I'm going to turn it over to you to just thank everyone and close us out.
Great. Thanks so much, Riley. And we are at the top of the hour, just a little past. So I just want to take a minute to thank Sonia White from Community Council of Greater Dallas, Tarika Wheeler from Safe Kids Worldwide, Bevan Maynard from St. Joseph's Children's Hospital in Tampa. I'm very grateful for all of your great presentations, really stirred our thinking. And I want to also thank the team over at GMMB for hosting and keeping us moving. They always do such a great job. That's why these that's why our webinars are so well attended, and we hope that you find them very useful. Just want to end by thanking everyone, wishing you all a good Memorial Day weekend coming up, and also think back to that poll. It is definitely the right time to start planning for back to school, and we'll be sharing more about that with you in the coming weeks. So thanks everybody very much.
Thanks so much, Donna. We'll sign off now. Goodbye, everyone. Have a nice afternoon.